Hi there. My name is Debbie Callender, and I want to talk to you briefly about a condition called delirium. Delirium is a confused, disoriented state that is unusual for the person presenting with it. It fluctuates, meaning that the confusion and disorientation change over time, and this usually comes on over a period of a few hours or days. This confused state is not one that has been constant for months or years. It's important to talk about delirium because it's often missed. Findings in research show that the prevalence is estimated as high as 25% in hospitalized older adults, and that 45% of patients admitted for palliative care in one study all presented with symptoms of delirium as well. It's also important to talk about it because once the underlying cause is treated, the confusion may improve. Some people, it improves immediately, although it might take up to 18 months in others, and for some, unfortunately, it never resolves completely. Some of us are at increased risk for delirium. Those of us who take certain medications, for example, are anticholinergics and antidopaminergic drugs, but also some analgesics, antibiotics, antiarrhythmic drugs, antidepressants, antiepileptics, antihistamines, benzodiazepines, beta blockers, calcium antagonists, diuretics, cardiac glycosides, neuroleptic drugs, lithium, anti-Parkinsonian drugs, and others. So it is important for us to discuss the potential for delirium with our doctor when we are being prescribed medication. Surgery post-operatively can also put us at increased risk, particularly if there is tremendous pain post-operatively. Any severe illness can put us at increased risk, particularly the elderly and end-stage cancer patients are very susceptible to episodes of delirium. Infection can also put us at increased risk, and in some elderly patients who do not complain of otherwise feeling unwell and are not monitored for temperature, sometimes the confusion can be one of the first signs that there is a severe infection on board. If we have had any episode where we have been deprived of oxygen, not been able to breathe, what we call hypoxia, immediately post that incident, we may be susceptible to delirium. Age is a major risk factor. Well, the older we get, the more likely we are to develop a delirium. And dementia itself is an increased risk factor for delirium, as is substance withdrawal, inflammation of any kind, and dehydration and electrolyte imbalance. And they are different things, so check it out. Delirium that lasts for more than perhaps a few days in terms of resolution. We're now calling it what we call long-term cognitive impairment, LTCI. Pandarapande et al., writing in the New England Medical Journal this year, 2022, found that survivors of critical illnesses often have prolonged and disabling forms of cognitive impairment that still remain inadequately characterized. Therefore, we really want to treat the underlying causes of these confusions as quickly as possible. We want to resolve the confusion, but also potentially minimize the longer term impact that Pandarapande is talking about. Because this is a reversible state, we want to suspect it, particularly in an elderly person presenting or an elderly patient at home or an elderly parent at home. We want to suspect it and get it investigated as soon as possible. And also, we want to hold off on any conclusions about it becoming a dementia because we can't draw those conclusions at that point. We want to see if the symptoms resolve over time, and that requires that the patient is followed for a long period of time, probably 18 months, more than 18 months for sure. So what can we do on our own to sort of minimize our risk? Lawrence et al. In 2012 suggested that we pay attention to adequate hydration, and we're not just talking about water, and adequate nutrition. We always want to make sure that we have adequate pain control on board. We want to make sure that we are mobilizing ourselves. So even if we're unwell, perhaps trying to sit out of bed or go to the bathroom only would be beneficial, and physical exercise if we can tolerate more strenuous work, not when we're unwell though. And we want to avoid stopping any medication suddenly if that's possible. and monitor our friends, patients, and ourselves closely post-op for developing confusion. When we're recovering from an illness or a surgery, or if we are not feeling very well, or we have other risk factors, we probably want to minimize a lot of sensory input and stimulation during that time. Most importantly, if you have any signs that concern you, if you feel as if you're developing growing confusion, if your relative or your patient is, talk to their doctor or your doctor so that they can investigate appropriately. I can be reached at homecareforja@gmail.com if you want any clarifications or have any questions. Thanks for listening.